Welcome to Let's Talk Micro. Hello, everyone. My name is Luis Plaza, and I want to welcome everyone to Let's Talk Micro. I'll be the host of this podcast, which is about basic microbiology. It focuses on clinical microbiology, which is what I do. So I'm going to tell you a little bit about myself and the podcast. I am a medical laboratory scientist or a medical technologist. I went to the University of Central Florida in Orlando, Florida. Prior to that, I was in the Navy for 8 years. I am originally from Puerto Rico. I was born and raised there until I joined the Navy. How did I become so interested in microbiology and in the laboratory sciences? Well, just to make it short, towards the end of my enlistment in the Navy, I was trying to, find a job that I could use once I separated from the military. I always wanted to go to school, complete my bachelor's. And while you can do that in the military, sometimes it's challenging. So I just wanted to complete my time and then go to school. But at the same time, I wanted a job that I could use. Sometimes some jobs they don't translate well from the military to the civilian sector. So I found out about the laboratory sciences. They had an associate's program where you could go to school, and then once you completed that, you will serve an additional 3 years in the Navy. And then, but while you were going to school, that was your job full time. Growing up, I always liked science, and then this seemed interesting. I mean, we don't think much about the laboratory. At some point in our lives, we all have been to the hospital or a doctor's office, and we have some sort of sample collected, right? So we get our cholesterol check, our glucose check. If we get an injury, they might swab the area. If we have a sore throat, they collect a sample. So those results that our physician gets, our provider gets, physician assistant, nurse practitioner. So those results are produced by a medical laboratory scientist. We go ahead and test those samples, any fluid, blood. We do cultures. We, screen for the presence of organisms. So we are the ones that do that work, via instruments, via manual methods. So that's what a medical laboratory scientist does. So while I was in the military, that was an associate's degree. Once I finished my time in the Navy, I went to the University of Central Florida, and there I finished my bachelor's in medical laboratory sciences. So in this podcast, I talked about my experiences as a medical laboratory scientist with a focus in microbiology. I'm going to be going over the organisms, bacteria, yeast, microorganisms. I'll be going over biochemical testing, media, and also I'm going to be, having guests from other areas of outside of clinical microbiology. That way you can see how varied this field is, and there are many options out there. And as we go along, if I see any articles that pertain to the laboratory, I'm gonna, I reach out to the authors and I conduct interviews. So Let's Talk Micro. It's about bringing awareness about, to the medical laboratory sciences field. Like I mentioned, not too many people are aware of what we do. Even, in school, most people that I have known, when they complete this degree, they before, they find out about it by accident. They knew someone that went to the program. So there's not a lot of awareness about this field. So I want to achieve that through Let's Talk Micro. And of course, I want to provide information. Information is power. It makes us better at what we do. And we are all moving on with our lives fast. And sometimes, there's so much information out there that I want to bring it to one place. So the content of Let's Talk Micro, it's going to be suitable for, a microbiology student. Doesn't have to be a medical laboratory scientist. It could be, for your basic college micro. In summary, this content it's appropriate for all the levels of education in microbiology. Whether you're a PhD, either a professional like a clinic microbiologist or a director, or you're a student, all levels of education, from PhD, masters, bachelors. So this content it's appropriate for everyone. So I just want to make it as simple as possible so we can all understand it. As a student, this content will be very beneficial for you. It's always going to be there so you can use it as a review guide for your exams. And as I go through the organisms and their biochemical reactions, the agar, I'll go ahead and point out based on my experiences. I mean, I also teach, so I will be pointing out what you as students should be looking for, how to report things, what you need to keep in mind when you are going through a microbiology course. And as a professional, it will be a great tool if you need a refresher, if you need to be aware of, let's say, a new antibiotic that's out there, a new study that's been done regarding micro. So it'll be a good tool to reinforce the skills that you have. Like I mentioned, I'm a medical laboratory scientist, but I have worked most of my time in microbiology. So microbiology is all about repetition, and I will be talking about my experiences as far as, what I have seen, sometimes, what kind of media works best, what do you need to look out for when you're working a culture. And of course, I'll be explaining all these microbiology terms as well. But for those of you out there that might be just very new, I just getting started in college with a micro class, I will be explaining, what is done in clinical microbiology, right? Like I mentioned, you get your throat swab, you get some sort of sample collected, and we go ahead and plate it in agar, and then you put it in an incubator, given with some specific conditions, and then we look for organisms. So you need to know which organisms are normal flora in the area, so they live on the skin. You need to know which ones are pathogenic. And as this podcast progresses, that's what I'll be doing, explaining all this. That way you have a better understanding of what is done in clinical microbiology. So, that's my passion. That's what I love to do. And I hope that I can bring some passion to you as well and connect with other professionals in the field and talk a lot about micro. A question comes to mind: where can you find this podcast? Well, it's available on all the podcast platforms, your Apple Podcast, your Spotify, your Amazon Music. Basically, wherever you listen to your podcast, you can find Let's Talk Micro. And then I am also on social media. I am on Twitter as Let's Talk Micro 1 and on Instagram as Let's Talk Micro, no apostrophe. If you have a chance, go ahead and check out those pages, follow, leave feedback. Let me know what you think. Suggest any possible podcast topics. One of the advantages of all the technology we have is like, there's so much information and there are so many pages out there with microbiology information. So take advantage of it. Go ahead and follow on social media, subscribe to the podcast. Microbiology is a huge field. There are so many areas that you can work on. And I want to, shine a light to that by bringing professionals from different areas of micro. That way, you know what options are out there. I love talking about microbiology. I'm always been this passionate about what I do. And like I said, I hope I can steal some of that on you. I hope that you can learn something. And I think you're going to enjoy this. I try to keep the episodes, some might be a little bit longer, but I try between 20-25 minutes. So you can play them while you're working out, while you're on a drive. If you have a long commute, it's the perfect opportunity to do that. So I hope you like it. So once again, my name is Luis Plaza, and welcome to Let's Talk Micro.